Why are vulnerable seniors in Rhode Island nursing homes dying at such alarmingly high rates, twice the national average? Did you know that about 80% of pandemic fatalities in our state have come from congregate care facilities, such as nursing homes and Rhode Island Veterans Home? This is Mike Stenhouse with another edition of In the Dugout. Today, I'm following up on an earlier interview this month we conducted with a brave Rhode Island Department of Health whistleblower who claims that a severe lack of Department of Health oversight at our state's congregate care facilities has not only led to negligent and perhaps criminal treatment of the most vulnerable among us and leading to deaths, but has also become the artificial basis for the governor's extended restrictions on our state's general population because of this pandemic through extension after extension after extension of her declared state of emergency and related regulations. The initial interview we conducted earlier this month with Lisa Camuso, a longtime employee at the Department of Health, has been viewed almost 3,000 times, yet the media and the politicians don't want to touch it. Today, we're going to give you an update. We're going to provide you with some new evidence, and we're going to have a second whistleblower who you're going to hear from shortly, who will weigh in with his views on the matter. First of all, I'd like you to know that Lisa Camuso, our whistleblower at the Department of Health, for the second time since she started raising awareness about her concerns at the department, has been removed from her duties. Years ago, after she filed her whistleblower lawsuit, she was demoted. More recently, she was put back on temporarily to handle some complaints during this COVID-19 crisis. And since her interview was aired a few weeks ago on In the Dugout, she has been removed from taking complaints anymore, even though she's the most experienced person at the Department of Health in fielding and reporting complaints from our senior care facilities in the state. Also, the Drudge Report, Rhode Island, which if you haven't visited, you should look at because it covers the news that most media outlet won't allow you to cover, won't cover themselves, I should say. They released some emails showing a stunning lack of protective personal equipment at our healthcare facilities, even after, well into April, even after we knew that our senior care facilities were the number one most vulnerable people in our state. Yet for some reason, despite promises of federal aid and actual federal aid, employees and staff at nursing homes were not provided with adequate levels of personal protecting equipment. That was broken on the news. And then later today, in just a few moments, you're going to hear from a second whistleblower, a decorated military veteran. One of the critiques of our first interview with Lisa Camuso, I have to admit, was a little bit valid. We put up, if you recall, many excerpts of emails and reports that she had seen. We did not put up the original emails or the original reports because we didn't have permission from her at that point to do so. We have that permission now. So I'm going to quickly run through, again, just to recap very quickly, and this time show you the actual evidence that we discussed with Lisa. And then we're going to get to our second whistleblower. So first, this first email is one where we talked about swamp water after they're cleaning the water with dirty diaper, feces, and whatnot in it, flowing from room to room. What we quoted in the first interview, you see on the left, the actual interview, the actual email and evidence, which we can now show you, is on the right. So there's the actual email of that. Also, we talked about during that there were some issues with drugs being smuggled in to some of these COVID-19 facilities. So again, in the first email, and I'm a little fumbling around here, I'm not the best at my computer, but that's okay. Here you see, again, on the left is what we showed you in the first interview with Lisa. On the right is the actual email report. Of course, we've blocked out all the names and personally identifiable information, but there's the actual information that showed how one man and his roommate both were on the floor and incapacitated because of drugs. And this was in a COVID, as you can see up here, a COVID-19 step-down unit, which is supposed to have special security for patients who had tested positive. Next, we're going to show you again another email, if I can find it. And I apologize for fumbling. This time I'm trying to be producer and host at the same time. Now, this particular email shows how patients were allowed to stay in the same room. Patients who had tested positive were allowed to stay in the same room as those who tested negative. In this case, it was a husband who was allowed to stay in the same room with his positively tested wife. Again, why would we do that when we knew that was going to enhance the spread of the disease? Again, what we showed you in the first interview on the left, and what the actual email on the right. So again, we're just trying to validate the items that we came under criticism for in our first report. Next, we have an email that talks about how patients were becoming severely dehydrated and other negligence, whether it was bed sores or whether it was malnutrition. Before, and these were COVID-19 patients. So again, what we showed you in the first interview, the excerpt on the left, the actual email. In this case, the complainant astoundingly makes the case, you can see with the red underline from this patient's daughter, that her father was not in an end-of-life situation, but yet they gave the patient morphine, which is just saying, we're going to ease your pain and just let you die. No attempt to resuscitate, no attempt to heal, taken off antibiotics and other drugs. They just gave up on this person and let them die. You got to wonder how much of this is going on. And this is another reason why what we're talking about must be investigated by the Rhode Island Department of Health. We cannot let this stuff go. And this last email that I'll share with you here in just a moment is an email that talks how family members are being denied the information, in this case, photographs of their loved ones. When you talk to your mother or your father or whoever on the phone and they complain about something and you ask the staff if they have a bed sore or something like that, you say, I want evidence of that. Well, the staff is routinely not providing that evidence. And we have many instances like this. Again, the excerpt on the left, the actual email on the right. And the theory is that they're just trying to cover up the negligence of the staff. We know the staff was a little bit understaffed, right, during the COVID, but still, if negligence is going on, it must be investigated. So those are the emails that backed up the excerpts we put in our interview with Lisa. Next, I'm going to show you a couple screenshots that kind of go to the larger issue here. The issue is, as Lisa Camuso, our whistleblower, claimed, that there are thousands of cases submitted to the Rhode Island Department of Health that were just never investigated. In fact, in many instances, in thousands of instances, they weren't even entered into the system to be considered for investigation. Again, how does this happen? This is why it's so important that government oversight entities look into what's going on at the Department of Health. So here you see a complaint, official complaint filed at the Department of Health. And you see in the red line, again, I'm not going to get into all the details here, but the red line says we never hear back, and she fears for the residents' safety. And this is a pattern we see over and over again with family members, with staff at these facilities, and it's what we also see at the Department of Health from our whistleblower herself, who says that complaint after complaint after complaint comes in and nobody investigates it. And you want to have an idea of how many we're talking about here, you're going to be astounded when you see this. This email, well, these are two screenshots we've put together. On the left, you can see the highlighted folder. These are complaints from assisted living facilities, ALR, assisted living residents, triaged with no action. Okay, means we saw them and we're just not even gonna look into them. We're not gonna do anything about them. Then I can't show you it right here, but then you scroll to the bottom, you can see that that's 4,642 items, uninvestigated, not even entered into the system. Complaints taken in and they're just stuck into a folder, and it appears as if nobody ever follows up. How can this be? Thousands of complaints not being properly investigated. This backlog, according to our whistleblower, is enormous. Why? Well, let me give you one theory here. You may have seen in a report somewhere around June, early June, that Rhode Island's nursing homes are ranked very high among all states when it comes in the nation. And of course, the bureaucrats at the government touted that what great care is being taken care of our seniors. But how can this be when there are so many complaints? Well, you know what? If those complaints were entered into the system, there's a very good chance that that oversight agency, that federal government would see those complaints, and it's very unlikely that Rhode Island's ranking would have been so high if the actual number of complaints and the actual complaints themselves were officially logged into the system, or investigations that might have uncovered wrongdoing were actually conducted. In neither case did this happen. So you have to wonder if Rhode Island's ranking in this regard is legitimate. And as a whistleblower said, if you hide the complaints, you'll eliminate any concern that the Rhode Island Department of Health should be recertified. And that means millions and millions and millions of dollars in federal funding. So you got to wonder if there's some kind of conspiracy going on here. Again, just another reason, I don't know the answer, just another reason that House oversight and other oversight committees need to look into this. Yet inexplicably, the media and your elected officials remain uninterested in this tragic story. These horrid conditions obviously persist. I mean, our whistleblowers, hundreds and hundreds and hundreds of these kinds of emails and reports. These conditions persist in our congregate care facilities. I mean, these are Rhode Island senior citizens. The most vulnerable among us are suffering every day from neglect, and they are dying unnecessarily and without any treatment, and yet nobody wants to look into it. And still, the House and Senate oversight committees refuse to convene to investigate. Why? Why are so many people failing to do their jobs? It's stunning to me. The media won't touch this. It appears as if nobody cares. It seems as if the politicians and the media are willing to just stick their heads in the sand rather than to expose a scandal that might hurt the images of their two new monarchs, Rhode Island Governor Gina Raimondo and the Rhode Island Department of Health Director Nicole Alexandra Scott. It seems as if nobody wants to tarnish their images. In just a few moments, we will discuss one such case and others that may have not been investigated, and which was actually reported to the Rhode Island Attorney General's office. It deals with a Rhode Island Veterans Home resident who choked to death when he was given the wrong type meal. This could have been criminal activity, not just negligence. Joining me now to discuss this case, as well as other instances of potential neglect at the Veterans Association, is the commander of the Rhode Island Department of the Italian American War Veterans. This is a congressionally chartered national organization since 1981. An American hero himself, John Cianci has served 2 combat tours, including in Desert Storm, and he earned the Bronze Star. Commander John Cianci, thank you for your patriotic service to your country, and welcome to In the Dugout.
Thank you, Mike. On it.
As you know, we kind of have a tradition here, and since you have an official cap, we're going to go with that tradition. Since we're in a baseball dugout, we should be wearing baseball caps. And let me just first say, and not to diminish the seriousness of the situation we're about to talk about, but it is a tradition. We wear baseball caps on In the Dugout. So I'm going to wear my Pawtucket Red Sox hat, since the Pawtucket Fire Department is one of the groups that will be referenced in one of the emails we'll look at. John, what cap you got for us today?
Well, I'm going to have my Italian American War Veteran cap.
Beautiful.
We proudly represent our organization throughout the veteran community and through different events that we attend and everything.
Thank you, John. Now, even though you yourself are classified as 100% disabled veteran, you continue to provide service to your country and to your state. You've been in this role as commander of the Rhode Island chapter of the Italian American War Veterans since last year. It is your right to appoint a member to the governor's Veterans Affairs Advisory Committee. But maybe just very briefly, you could tell us, what is the mission of Italian American War Veterans in the state?
Our mission is pretty simple. We're a veteran organization taking care of our veterans, advocating for veterans, families, and their widows, and making sure that our veterans get all their entitlements and benefits that they are entitled to, and especially in the healthcare field, including overseeing being part of the Rhode Island Veterans Home community.
Now, you yourself consider yourself a whistleblower. You have filed complaints up through the system, including to the Attorney General's office and to the governor. Before this, can you talk just very briefly about the one complaint you filed earlier this year?
I filed a complaint with the Attorney General's office, which was several staff members contacted me about an incident that was at the an incident of a death of a veteran at the veterans home.
And let's bring up that email, Larry, while John's talking.
And prior to that, I had filed with the VA Officer Inspector General's office about some issues at the veterans home, lack of care because of change of policy and everything, which is a formal investigation ongoing.
So what you're looking at here, and John, I'll have you comment further here in just a second. So on the left is the excerpt we provided on the screen when we interviewed Lisa Camuso from the Department of Health a few weeks ago. On the right, far right, under the WellSky, which is their healthcare reporting system, is the actual complaint. You're the one who sent in that complaint about the veteran who choked to death after being given the wrong meal. There was no nurse on duty who showed up for a good 25 minutes. The people that were there gave him the wrong, he was choking and they were giving him water, which made him choke even more, and he ended up dying. And so tell us a little bit more. And here's the evidence that we didn't provide, the actual report. In the middle there is a little excerpt of your email and a response you got. So John, tell us a little bit more about what happened here.
Yeah, that is definitely my complaint. I first received notification the night of the incident from someone that was there at the veterans home. I did not see it till about a week later when I was at the veterans home handing out the K95 mask, when I was told by a exiting member of the staff to check my FaceTime messages that there was a message about a death of a veteran the following week. So when I did check the message, I did see the details, and then I received messages from two to three other staff members that pretty much said the basic same information, which at that point I felt it was my duty to act to push it forward.
Now, what concerns me, listen, negligence happens, accidents happen, but we have oversight. The Department of Health, in this case, you think maybe something criminal. At least are you aware that there has been any government agency that has looked into this incident? I mean, did you file the complaint with the Attorney General? Have you heard any response from anybody?
The only response that I received was a control number on an email provided back to me from the Attorney General's office. No contact, no further requests for more details. And then talking to the people that contacted me from the veterans home, none of them have been contacted about this incident as of earlier in the week.
So a veteran in a state overseen veterans home dies. There are suspicious circumstances of negligence, both from the nursing staff, from the dietary staff. There's a complaint filed from somebody with status, you, and as far as you know, there's been no action other than an automated response.
No, absolutely.
And this is why further investigations are warranted. All right, let's look at the next slide, which is a letter that the state put out. This is guidance from the Rhode Island Department of Health that the state put out, basically saying, I'll have you describe it more. And this is something you also raised your hand about, that basically said, if you are a staff member and you tested positive for the virus, if you didn't have symptoms, you could come back and work among the veterans. Do I have it right?
Yes, correct.
And your concern?
Well, my concern was, first off, that this was a policy that the other states rescinded, like the state of New York, because asymptomatic people are contagious, and it's detailed that in the CDC policy. And here we are,
You're saying the CDC policy does agree that asymptomatic spread is possible?
Oh, absolutely. And it was even in the news this week that.
But yet our Department of Health is putting positive staff members in with otherwise healthy or non-positive residents in nursing homes and in veterans home, right?
Yes, and that's been the policy right along, not just of this effective date.
Well, let's go to the next slide. You obviously were not happy with that policy. And as we're going to show in a future slide, you were prophetic, unfortunately, in that. But here is the acknowledgement that you had concerns, and you had legitimately had concerns. You show a great timeline over here on the right, that this policy of allowing infected members to work in the veterans home led to what you define here, and I'll let you take us through it very quickly, a whole chain of events that led to many infections and deaths. John, go ahead.
Well, it's clear that March 12th, not one veteran had tested positive. And then over a month later, they're testing positive. So there was.
This is after this policy we saw earlier was implemented.
Well, this policy wasn't until May.
Okay.
However, they were the reports that I was receiving from the veterans and the staff members and everything, that they were being told that they would continue to work, and if they were asymptomatic. And the information that was being put out by the governor was they were being in isolated areas and working with those only veterans that were or residents that were tested positive, which was not the case. There was an interview on WPRI. They talked to a veteran at the veterans home who supported that they were going from one unit to another unit and everything, and basically they spread the disease.
And you document here that 4 residents died, 17 tested positive, along with 28 staff members who tested positive because of this policy, whether it was formally, informally being practiced, or formally after that. But you say, down near the bottom, this virus was brought into the veterans home after March 30th because of, basically you're saying because of bad policy.
Absolutely. And
we shouldn't just look in the past on this, right? I mean, this is happening now, right? And a staff member potentially, so you called back, the date of this email was May 27th. You're calling, you copied a lot of lawmakers here, you copied a lot of government officials here, and you were calling for this policy. You called it to be updated, but what I think you meant, really mean here is to reform it, is to stop this practice, right? That's what you're calling for, right?
Correct. Rescind the policy.
And that policy is still alive and active today.
Yes, according to the website.
So seniors in nursing homes and Rhode Island Veterans Home are still subject, we don't know what the reality is, of infected staff members working among them.
Yes, and they did respond to the media on this, where they said that there's a policy that they have to get it approved, and that there's a whole protocol in this and everything. But this whole policy is because an employer is lack of staff, where the alternatives are there. We have FEMA resources, nurses and CNNs and even VA employees that are available and are currently being used. So here we have an oversight that allows this, but they're telling us at every press conference that they're doing everything to protect our residents at these nursing homes. And
yeah, we'll circle back to that. Yeah. All right. Now, it's not just among the staff, John. Let's go to the next slide. This one is a complaint that shows even among the infected residents at the home that they were not isolated, and that they were allowed to walk among the different wards and into the rooms even of non-infected patients. So as we bring up that email complaint, can you confirm that, John? I think it's actually a different email, Larry, but go ahead, John.
Yeah, I had received a call from a veteran that's at the veteran's home, Jack, and he was all upset that one of his friends came walking into his room to tell him that he was one of the ones that had tested positive, and he is on oxygen assistance as it is, and he was outraged that this could happen, and according to the veteran, he filed a grievance complaint at the home about this type of veterans were being allowed to walk around. Now, understand that under HIPAA, the veterans don't even have to identify themselves that they are positive. So the only way the veterans at the home know that someone's tested positive, they're seeing the caretakers having all the PPE on and everything. So here's an incident, whether it was not that the information had filtered down and restrictions had been put out yet and everything, but it did happen. And that was from the words.
So we've got both staff, infected staff, and infected residents themselves basically working among the non-infected. Okay. Let's go back to that prior email about the home complaint. Want to make a quick point there, then we'll quickly get to the last slide as well. But so I assume these are fairly routine. You receive complaints like this regularly. Is that correct?
It was very it was almost on a daily basis that while we were going through this COVID-19 incident, that there was constant concerns about what was being put out as policy that was not happening at the veterans home. And that's where I felt that my duty as a department commander and a service officer is to communicate directly with the governor to say, look, these are veterans' lives and lives at stake here and everything. Mistakes are happening.
Well, and sometimes you actually get visual evidence. So this next slide, I want to warn you, is a little disturbing. It involves bed sores of apparently veterans. We know that during the lockdown that family members are not allowed to see their loved ones. We even know from the Department of Health that they're not even allowed to go there. They have to conduct investigations by phone. But when you see, you get bed sores like this because you haven't been moved or rolled over. I don't know, you can tell us more about it, but it seriously would indicate the potential for neglect here and abuse. And another reason why this needs to be investigated. But when you see something like this, John, to a veteran, how do you feel?
It's heartbreaking. The best oversight that we had there were the families being able to be and their loved ones being with their veterans and at the nursing homes. And here they've been isolated. These are photos that were sent to me along with about another dozen of them and everything. And it's certainly, and these 2 to 3 employees that are sending me this information, they feel that these veterans have no voice and that these veterans are just being allowed to die because there's not enough staff there. There's not enough oversight, happening and everything to fix these problems. This is real. This is not a photo taken off the internet. This came from a staff member at the home, sent to me And I pushed it, pushed it forward and everything. But and that's what I try to emphasize. But these workers, there's at the nurse at these homes and everything, they're overworked. They try to do their best, but they feel that their voice isn't heard because they'll be retaliated, against, and no action will be taken because they seldom talk to investigators.
I mean, those photos, I mean, again, we understand that bed sores happen, but we don't know if it's happening routinely. We don't know if it's happening because of neglect. We're not trying and convict anybody here. But when you see what we just looked at, and you consider that neither the governor, neither the director of the Department of Health, neither the leaders in the General Assembly or the House or Senate oversight committees have lifted a finger to even look into this to see if there was any criminal or negligent wrongdoing. How does that happen?
Well, how it happens is we have a system right now that the oversight's not there. We've taken out the biggest factor out of it for protection of these veterans and nursing home is their families. And they've been isolated with, since early March that they haven't been able to see them. And then you have this other COVID-19, which gives them the umbrella, to keep the policy going forward. And then you have the HIPAA protections.
Yeah.
It's
all right, let's let me rapid fire. Let's do a rapid fire round here, okay?
Okay.
I want to take you through very quickly 7 or 8 of the allegations that were brought up about overall Department of Health oversight of all these facilities, nursing homes, veterans, whatever, all the congregate care facilities. And just tell me if they ring true to you. I'm not asking if you have evidence, and if it doesn't ring true, say, no, I can't believe that's happened. All right, so Lisa Camuso talks about thousands and thousands of complaints backlogged, not being investigated, and in most cases it appears not even being put into the system to be investigated. But that makes sense to you that might be happening.
First-hand information from veterans and their families, yes.
We looked at an email of unsanitary conditions in the email we looked at just earlier in my monologue here was after they washed the floors, there's diapers on the floors and the feces spreading under the doors from one room to another. So just general, would you say the conditions are nicely sanitary at these veterans homes?
I've never seen it at an issue like that at the veterans home, and it's always been immaculate.
Good, glad to hear. PPE shortages. We know that many nursing homes, we saw the complaints that came in. Drudge Report RI put up some emails this week that showed staff complaining about not having access to PPE equipment despite promises of federal money and actual federal money. Did that exist in veterans homes?
Yes, from the staff members themselves.
We saw one email of in a COVID-19 step-down unit where presumably there's greater security and care going on. We saw an instance of 2 men, roommates, getting access to drugs that were smuggled in and both taking the drugs and being incapacitated on their beds or on the floor. Ever hear anything like that in the veterans home?
No, never.
Good. We did talk about roommates, or at least people infected being able to roam among the non-infected class. So we just confirmed that happened, correct?
Correct.
Now, those horrible pictures we just looked at of bed sores. Lisa Camuso talked about how in nursing homes, she's received complaints from children of residents there that when their parent, for instance, would complain about a sore or something, that the staff would not send them the pics. You have some pics sent to you for staff, but have you heard complaints from family members that evidence potentially of neglect or abuse of these seniors is being withheld from them?
Yes, I've received some of the pictures from the families.
But I'm saying, are there cases where the families are being denied information they're being asked for, they are asking for?
I can say not from the families that I've spoken with from the veterans home.
And And then the worst of all the allegations we talked about with Lisa Camuso was that many veterans, or I should say many seniors, whether in nursing homes, and I'm asking you if you think it might be true in veterans homes, were either never transported to the hospital or kept, or even when they got to the hospital, they were just given up on. They were taken off their antibiotics and they were given morphine, ease their pain, and just allowed to die. Have you heard of that one?
Not at the veterans home, no.
Good. Now, we have discussed many things that we have talked about that you're aware of. You're part of it. There are many other state chapters. I'm sure you talk to your colleagues in other states. Are these kinds of complaints and conditions happening in every state, or is Rhode Island unique in this? What do you honestly think here?
It appears to be a systematic problem at veterans homes, but they do have, you've got the New Hampshire Veterans Home that has 0 positives and zero deaths. So it's not happening everywhere, but it is a widespread systematic problem that the VA and congressional leaders are looking into reviewing.
And then there was that horrible veterans home situation up in Holyoke, Massachusetts, right? What was
Absolutely.
it, 70, 80 people died up there?
82 people. And they all have, that home has the same patterns, PPE shortages, understaffing, all the ingredients to make this perfect storm, which is basically, I mean, it's killing our seniors at these veterans homes and nursing homes.
Yep. Well, as we discussed earlier, at least some members in the General Assembly are calling for the House and Senate oversight committees to look into this, but yet leadership of those committees and in the General Assembly have resisted. While they may be getting back together in some capacity in the middle or end of this month, we don't know how much regular business. So let me ask you 2 questions. A, are you yourself calling for House Oversight Committee into these potential abuses? And B, if so, would you be willing to testify as to what you know?
Yes, on both of them. And I've testified, and it's clear that we have a major issue with the COVID-19 and some concerns of the voices of the veterans, the nursing home residents, and the families not being heard at this time.
I hope those hearings happen soon. All right, I'm going to ask you the exact same question I asked Lisa Camuso, and you referred to this just a little while ago yourself. So earlier this month, Director Alexander Scott publicly said that during this crisis, the Rhode Island Department of Health is doing everything they can to ensure the safety of seniors in our nursing homes and assisted living facilities, and that would include veterans homes, because lives matter. Now, when you look at the response or lack of response you've gotten from government and the Department of Health, the Attorney General's office, do you feel that the Department of Health has done everything it can to protect the lives of seniors in the veterans home?
No. And the record speaks for itself. The asystematic policy, they have National Guard resources and FEMA resources. For example, once to be quick on it, they're not fitted for their masks that they wear like hospital healthcare workers are. You could use the National Guard for that type of fitting and everything. All these extra protective measures, including the robots that kill the virus and everything.
So needless to say, you've got a lot of good ideas and no one's listening.
It doesn't appear listening in Rhode Island, or it's a slow moving process and lives are being lost because of it.
She ever responded to you?
I didn't get that. I'm sorry.
You've also sent emails and appeals to the governor herself. Has she ever responded to you?
She has never responded to me. All I received back is the automatic responses that their office has received the information.
So between, you told me earlier that you've sent 8, you are a person of status in the state. You are the commander of a federally chartered war veterans department in this state. You get to appoint people to the governor's veterans Advisory Committee. You have sent 18 emails up the chain. You are not just average Joe citizen. You are a person with status, federally recognized, and you told me that you have never received anything more than an automated response to any of your 18 complaints. Is that true?
That's true.
Wow. Wow, that's not government working for the people, I can tell you that. One last item that is much more subjective, and if you care not to comment, because it kind of gets a little political, but I want you to comment on it if you want. Lisa Camuso, our first whistleblower, you being our second, believes that while certainly no one's suggesting that seniors are dying on purpose in these homes, it does appear as if they're dying unnecessarily because of negligence, but that the state government is exploiting these high numbers and high rates of death. And we know 80% of the deaths from the pandemic in our state are emanating from these senior care facilities as a means to continue the state of emergency and to impose harsh regulations on the rest of society, when really most of the problems are happening in these senior homes. Do you care to comment on that theory?
Well, I certainly believe that that the current conditions allows our government to continue to operate under these conditions, but it's and it is to me, it's been a money issue of their actions and everything, that they feel they can get the federal money out there. I know in Connecticut, those nursing homes that are contracted, per day they get $600 per nursing home resident that's at the homes and everything. And what the actions, we have not been proactive in this state to prevent these deaths and everything. We're number 2 and number 3, 80%,
Right.
80%. So whether it's political or not, we need to be better at it, and it needs to happen immediately.
The governor, the director of the Department of Health, the attorney general, you have made appeals to them. They have never responded. If they are watching right now, final question, final comment, make your appeal to them right now, John.
Put our resources, the state's resources, at these nursing homes, and let's fix whatever wrongs that we had, and let's do it to save lives. It's nothing more than what we need to do to protect the most vulnerable citizens that don't have the voices and don't have that best protection, their own families able to see it. Open up the nursing homes with a procedure to allow visitations like Mass has done and other states have done. It can be done and be done safely.
And to General Assembly leaders and Oversight Committee chairmen and chairwomen, what do you say to them?
I say, let's see what has caused these deaths at these nursing homes, at the veterans homes, and we need to fix it and move forward. This isn't going away, this COVID-19 or these other issues.
There's still time, right? There's still time.
There's still time, and lives matter. And we must treat it as an urgency. It was declared a war, but we are slow in acting. Rescind that policy, the asymptomatic.
He is a decorated war veteran. He is commander of the Rhode Island Department of the Italian American War Veterans. Commander John Cianci, thank you for your insight. Thank you for your courage in standing up as a whistleblower and for being my guest on In the Dugout. Godspeed.
Yep, Godspeed, Mike. Thank you for having me.
Thank you, John. For In the Dugout, pleading for House Oversight Committee hearings, this is Mike Stenhouse with the Rhode Island Center for Freedom and Prosperity. Good day.